beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and today's video is about Boerhaave Syndrome, or effort rupture of the esophagus. So if you want to find out more information about how this rare condition is actually caused by very common processes in our bodies that happen every day, then just stay tuned because I'm going to get into it right now. So, as I was saying, Boerhaave Syndrome is an effort rupture of the esophagus. And just so that we're all on the same page, in case you don't know, the esophagus is pretty much the tube that connects your throat to your stomach, basically. So when you eat or drink, okay, the food goes down into the esophagus and it goes right into the stomach. And that is your esophagus. The Boerhaave Syndrome condition basically is where you get a rupture or a perforation in the lining of that tube, okay? You're not supposed to have that. And it's rare because about 3.1 in a million per year is the incidence of this condition. So what exactly are those common things that can cause Boerhaave Syndrome? Very common things like straining if you're trying to use the bathroom, vomiting, or you can have much less likely, it can happen during childbirth, during seizures, during prolonged, coughing or laughing, and it also can happen during weightlifting. And the reason for this is that it happens when you have a sudden increase in intraesophageal pressure, or the pressure inside the esophagus, at the same time that you're having a negative intrathoracic pressure that's happening in the chest. So when you have a sudden onset of a combination of both of those things, you can have a rupture in your esophagus. And that happens when you are straining, vomiting, sometimes during childbirth, sometimes during seizures, if you're having prolonged coughing or laughing, and also when you're weightlifting. These particular instances have moments where you have sudden increase in intraesophageal pressure at the same time that you're having the negative intrathoracic pressure. And then that's how the rupture happens. So another term that I want to go over is the mediastinum, which is basically the space in between your lungs, okay? In the middle here. And it goes, anterior to posterior, front to back. There's a couple different real important organs in there, one of which you are very familiar with, and that is your heart and all the vessels leading to and from your heart. They are within this space. And when you have Boerhaave Syndrome, when you have rupture of the esophagus, basically things that you're eating and drinking, and if you happen to be vomiting, things are coming up the other way, but these things are supposed to be contained within the esophagus. And when you have a rupture of the esophagus, those contents, whether it be the food you just ate, whether it be, water that you just drank, or any other type of substance that you may drink, or whether it's the contents of your stomach and acid coming up during vomiting, those things are supposed to be contained within your esophagus. But when you have a rupture, those contents can leak out into the mediastinum, contaminating all of the important organs within, including your heart and the vessels to and from your heart. So going on to how this is diagnosed, you can see on a chest x-ray air in the mediastinum, okay? Air is not supposed to be in the mediastinum. And when you see that, that is called pneumomediastinum, and that would be reported on a chest x-ray of someone who is having Boerhaave Syndrome. If you're a person who may be experiencing Boerhaave Syndrome, some of the symptoms that you may have, and again, mind you, this is after those instances that I named before: straining, vomiting, childbirth, seizures, coughing for a long time, laughing for a long time, weightlifting. After you are doing that, you feel some type of pain in your upper abdomen, in your chest. Throughout, you may feel the pain going up your neck. You may have some difficulty or pain speaking, or pain when you eat. Really, really bad pain behind your chest, okay? Behind your sternum, within your mediastinum. Why? Because the contents that are supposed to be in the esophagus are now leaking into the mediastinum, causing you pain. So it's very important that if you are having this, and I wanted to mention it because although it is very rare, I did see this recently in the emergency department where someone had been having prolonged vomiting over several days. And of course, when you've been vomiting for several days, whether you're having a stomach bug or whether you're having food poisoning or whether you're having a viral illness, like the flu or anything that can cause vomiting, diarrhea, those type of things, you're naturally going to have some stomach pain because you've been vomiting. Vomiting by nature takes muscles to actually forcefully get the food out of your body. That is one of the body's protective mechanisms. So you may be having pain, but the difference with Boerhaave syndrome is you're having that pain really radiate up. It's severe. You may even feel short of breath. You may be having a rapid heart rate. You may be having fevers, because what is happening is the contents that are supposed to be in your esophagus or food or whatever you're drinking are now leaking out and contaminating the mediastinum. And obviously, the longer that this goes on, the more you can have complications and contamination of those organs in the mediastinum, which would cause inflammation, mediastinitis, which is basically inflammation of that part of the mediastinum, and also infection, because you're leaking acid basically into this compartment, and that acid is causing degradation of tissues, which is going to cause more inflammation, and it is a breeding ground for infection because you're having lots of things be contaminated in there that are usually pretty much walled off from the GI tract, which is the esophagus, the stomach, and the intestines. And now that's perforating into the mediastinum, causing a contamination. So this very rare condition can be fatal because of that. Like I said, your heart is in there. The vessels that are going to and from your heart are in there. And if those are getting contaminated by acid, bacteria, inflammation, your heart's not able to work properly, okay? And all of the organs in there are getting involved and suffering complications from this. And like I said, it can happen from very common things like vomiting, like coughing, like laughing, although it is very rare. The other thing is that I totally am having a blank right now, but I just wanted to let you know that these things are common, but the condition itself is rare. But if you are someone who has esophagitis already, which is basically irritation and inflammation of the esophagus, and you can have that by either medication induced or pill esophagitis, or if you have genetically you're predisposed, or you have Barrett's esophagus, or if you have some type of infection or ulcer, something that causes an ulcer in there, you can lead to a perforation because the tissues are already much weaker. The lining of the esophagus is already compromised, so it's easier to tear or perforate and rupture when you are having one of these other processes go on, like coughing, laughing, vomiting, straining. So I just wanted to put that out there. If you are someone who has Barrett's esophagus, or you have ulcers, or you have medication-induced esophagitis, then you are already at higher risk of having Boerhaave syndrome, which I said is very rare, but it can be fatal. So that's why I just wanted to put that out there, because I did see this recently in the emergency department, and because it can happen with things that are very common, I wanted to just bring in some added symptoms that you may have. Not just belly pain with your vomiting or something like that, but the pain radiating up into your chest, behind your sternum, your heart area, problems with speaking, pain when you eat, shortness of breath, rapid heart rate, just like way beyond anything that vomiting or straining should cause, like pain and symptoms that you should not be getting from a normal bowel movement or normal vomiting, normal coughing, normal laughing, like I said, childbirth, seizure, weightlifting. So I just wanted to put that out there. So these are things that you can kind of be knowledgeable of if you or someone you know experiences anything, any of these symptoms, okay? Because it's as simple as getting a chest x-ray, and it's very obvious, okay? It's pretty evident. I will put something like that in the little thumbnail for this video so that you can kind of see a little bit of what it may look like, but I mean that's not for you. You can Google it actually, but just in terms of for curiosity to have a visual to what I'm speaking about. But if you did learn anything, or you like this video, you like the content, if this increased your awareness in any way, please hit that like button. Please share this video with a friend, family member, loved one. Please subscribe to my YouTube channel if you like content such as this, where I am basically giving you medical knowledge and tips and tricks and things to look out for to keep you and your loved ones healthy, okay? If you have any questions, put that in the comment section below. If you have any comments, put that in the comment section below. If you have anything like a burning topic that you just need to hear me talk about, or some type of emergency, or something happened either in your life or somebody else's life medically related, and you want me to highlight that topic just to spread awareness about it, put that in the comment section below as well, okay? But as always, I want to thank you for sharing this wonderful Wednesday with me. Be blessed and stay healthy.